and welcome back to TIP TV Health. I'm delighted to be joined today by Dr Charlie Easmon, Medical Director at 1 Harley Street. Welcome, Charlie.
Thanks, Beth.
So look, it's coming into the winter months,
Yeah.
flu season is upon us.
Yeah.
We've had things like pneumonia in the news a lot recently with Hillary Clinton's hit. Can you tell us a little bit more about this?
Yeah, so flu and pneumonia to some extent are connected. One is viral and one tends to be mainly bacterial. And what happens with the flu season in the Western Hemisphere, it usually runs from around about September to January. And each year the flu virus reassorts itself. So that means it's got 8 genetic components which reassort themselves. So there might be a bit of a bird in there might be a bit of a pig in there, might be something else. So that's why each year there's a new flu vaccine. And what happens is the World Health Organization tracks what's happening with flu, says to the manufacturers like GlaxoSmithKline and Sanofi, make the vaccine contain these different components. So usually they contain about 3 components. Now, the thing is that the UK government funds about 14 million doses of flu each year, and the ones that it funds are for vulnerable people, so people with asthma, chronic heart disease, chronic lung disease, diabetes. So they're offered a free flu vaccination, and some elderly people as well. Now, it doesn't mean that if you're young and healthy, you can't benefit from a flu vaccination. It just means that you'd have to pay for it yourself. It costs about £10 or £15. And a lot of companies actually do offer that as a service to their employees. Now, some people would argue, well, is it worth getting a flu vaccination because, flu isn't that bad, is what they'd say. But actual flu is bad news and is a killer of many people each year. Now, if you're young and healthy, it doesn't mean you're not vulnerable to a virus. Viruses don't discriminate based on age. And the thing I say to people is to differentiate man flu from real flu is I ask them one question. If there was a £50 note on the floor, would you pick it up? And to be honest, if you had real flu, you wouldn't do that. You'd be so tired, you'd be lying in your bed, you'd have a fever, you'd feel terrible, your muscles would ache, it would last about a week, and you really wouldn't be able to do anything.
Okay. And so, again, moving on to pneumonia and what's been happening with the
Hillary Clinton and people like that. Absolutely, yeah.
What have you got to say about that?
So basically, pneumonias can be viral or can be bacterial. So they're basically infections of the lung itself, whereas flu is a more systemic illness. So by that I mean it causes fever, muscle aches and everything else. But pneumonia is more specifically an infection of the lung. Now, around the time of the flu season, there tend to be more pneumonias going round as well. So quite often you get a bit of flu and a pneumonia on top of that. And if you're elderly, that can be the thing that actually causes you to pass away, unfortunately. It used to be called the old person's friend, pneumonia as such. But anyone who's particularly stressed, working too hard, can be more vulnerable to both flu and particularly to pneumonias. So the classic pneumonia is what we call a lobar pneumonia, where the infection comes to a part of the lung and that part of the lung becomes very dense. So if I were to tap the back of someone with the pneumonia, the side with the pneumonia would have a very dull sound, like a dull drum, and they're the type of people who need antibiotics usually to resolve that.